Moskowitz to participate in this hearing for the purposes of questions. I now recognize myself for the purpose of making an opening statement. Mr. Cuomo, welcome. I want to thank you for your willingness to participate in today's hearing and for testifying in front of the Select Subcommittee more than 2 months ago. It took issuing a subpoena to get you to then agree to testify previously, so I appreciate you coming in voluntarily today. Before we get into the substance we are here to examine, I want to tell you that this subcommittee has been threatened twice this Congress. Once by the Chinese Communist Party through its embassy for examining the origins of COVID-19, and a second time by you through your counsel for examining the handling of COVID-19 in nursing homes. I can tell you, we have not and we will not bow to these threats. I certainly hope you do not approve of these tactics, or perhaps you aren't aware of them, Governor Cuomo, which seems to be a consistent pattern. Nonetheless, Select Subcommittee is holding this hearing today to examine your administration's handling of the COVID-19 pandemic in New York. Specifically, we want to focus on the issuance of a directive that resulted in the admittance and readmittance, according to the AP, of more than 9,000 potentially COVID-positive individuals to nursing homes. The Select Subcommittee has been authorized to investigate the COVID-19 pandemic and to explore lessons learned, positive or negative, to better prepare for future pandemics. Since the beginning of this Congress, we've been committed to conducting a thorough investigation, free from influence and unafraid to follow the facts wherever they may lead. We've acted in a transparent fashion, cognizant that Americans deserve to see our work and review all available information so they can draw their own conclusions. We're examining actions taken by Congress, including measures I voted for, but might want to do differently or better the next time, so that when the next shocking pandemic occurs, we have looked back, found what worked and what didn't, and established a workable system so that we may endure. This is an after-action review in hopes of being able to predict, prepare, protect, and perhaps even prevent the next pandemic. In search for best pandemic practices, today's hearing is focused on New York and the March 25, 2020 directive from the New York State Department of Health issued under Governor Andrew Cuomo's leadership. In this investigation, we have reviewed more than 500,000 documents, and we've conducted 10 transcribed interviews with members of your administration, including you. Our findings are based on the evidence and testimonies that we have received. This is a comprehensive and painstaking endeavor to find out what happened in New York nursing homes, with more than 2,000 pages of testimony publicly released to support our conclusions. Simply put, America cannot move forward without first looking back. And that includes examining your directive, Governor. Mr. Cuomo, I think you'll agree that New York State became ground zero for much of the pandemic in the United States. In the earliest stage of the pandemic, COVID-19 was a novel virus, and there was little information and a lot of unknowns. But it quickly became clear that COVID-19 was particularly dangerous for the elderly. We all saw the deadly consequences of COVID-19 in nursing homes in Washington State, the earlier epicenter of the pandemic. There was a 1,000-fold higher risk of poor outcomes, specifically hospitalization and death for older people relative to younger populations. Therefore, it was critically important that the public health response prioritize protecting high-risk populations. This is an important lesson learned. This was understood by the U.S. Centers for Medicaid and Medicare Services and the U.S. Centers for Disease Control and Prevention, the CDC. On March 13, 2020, CMS issued guidance. I want to stress the word guidance, that specifically directed nursing homes to not accept COVID-19 positive patients if they were unable to do so safely, and to only accept individuals if the nursing home could follow CDC transmission-based guidance. Again, this guidance was a non-binding, federally issued guidance that's reflected by its language. The CMS guidance used terms such as can and should, consistent with the tone of guidance. A nursing home can accept a resident, this is a quote, a nursing home can accept a resident diagnosed with COVID-19 and still under transmission-based precautions for COVID-19 as long as the facility can follow CDC guidance for transmission-based precautions. Nursing homes should admit any individual that they would normally admit to their facility, including individuals from hospitals where a case of COVID-19 was or is present. This was not the case with the directive issued by your administration on March 25, 2020. While I know I like to play semantics and refer to it as an advisory, it's clear that it's anything but. Merriam-Webster defines an advisory as containing or giving advice. Your advisory refers to itself in the language as a directive in the very first paragraph, with your name at the top, Governor Cuomo. And it says, this directive is being issued to clarify expectations for nursing homes receiving residents returning from hospitalization and for nursing homes accepting new admissions. Merriam-Webster defines a directive as an authoritative order or instrument issued by a high-level body or official. That's what that was on March 25, 2020. In your case, that carries the weight of law. Your directive uses words like shall, must, and prohibit. It directs that all nursing homes must comply with the expedited receipt of residents returning from hospitals to nursing homes. It directs no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. An authoritative directive from the state of New York with the authority of law. No resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. It directs that nursing homes are prohibited from requiring a hospitalized resident who is determined medically stable to be tested for COVID-19 prior to admission or readmission. See, here's the problem. Medically stable can still mean highly contagious. The language in this directive is not advisory and it's not non-binding. The CMS guidance was and still is advisory and non-binding. Directive with the authority of law supersedes guidance. Prohibited means not allowed, and prohibiting testing for COVID-19 is nowhere in the CDC guidance. Because of this language, the March 25 directive was dubbed a must-admit order by the public and press, and rightfully so. Those words are not in there, but that's how it became known in the common vernacular in the public and press. But your directive was not consistent with federal guidance, nor consistent with medical doctrine. You do not put highly contagious patients in with vulnerable patients, subject to infection, and in this case, death. Your former commissioner of the Department of Health told us that you received the phone call from the Greater New York Hospital Association asking you to do something about nursing home residents that the hospitals wanted to be able to discharge. He testified that you were told that these patients needed to go home. And while you testified that you were not aware of the directive until April 20, 2020, you decided to keep it after learning about it. It remained in effect for almost 3 weeks after you knew about it. Governor, you own this. It's your name on the letterhead. This is your directive, whether you knew about it or not. You're the leader. The buck stops with you, or at least it should. It's important to look at your administration's record. 2 weeks after you learned about the order, your office changed the methodology of how nursing home fatalities were categorized. You removed out-of-facility deaths that occurred at the hospital, altering the full accounting of nursing home deaths. During your transcribed interview, when describing why you chose not to disclose the number of nursing home residents who died at hospitals, you remarked, "Who cares?" I'll tell you who cares about this. Doctors and nurses trying to save lives care about this. People dying and their families, they care about this. If someone contracted COVID-19 in the nursing home and died at the hospital, it matters. It is scientifically significant to know where, how, and why someone contracted COVID-19 and died if we're going to prevent this in the future. That is important data. In July of 2020, you released a report under the auspices of the New York State Department of Health that blamed nursing home employees rather than your directive for the deaths that occurred in nursing homes. Your spokesperson, Rich Azzopardi, described this report as peer-reviewed. I'm not sure if Mr. Azzopardi understands the peer review process. An effective response to the pandemic required a willingness to adapt to evolving data, to new information. It will be required for the next pandemic as well. It's important to review the data, actual data, to recognize the dangerous and disastrous consequences of your directive. A directive that goes against medical protocols and is considered by many medical professionals to be malpractice. You wrote in your book that it wasn't your, quote, place to filter or edit the truth, end quote. But it's clear that it seemed to be someone's place. You said, "Who cares?" But we do care about the truth because it's obvious that you don't like the out-of-facility nursing home deaths. It's a truth that matters. And that's why we're here today. To ask why you made the decisions that you or your executive team made. To try and account for your actions and responses without naming and blaming others, as you have repeatedly done, because we need to help America be prepared for the next pandemic and to protect American lives. And because infectious diseases like respiratory viruses don't recognize borders, we want to protect lives beyond our borders as well. I look forward to a strong, on-topic discussion today, and I would now like to recognize Ranking Member Ruiz for the purpose of making an opening statement.
Thank you, Mr. Chairman. Let me begin by taking a moment to acknowledge the seniors that our nation has lost to COVID-19, as well as the grief of the families who lost parents and grandparents during the pandemic. Each and every life taken by the virus is a tragedy, and I'm sorry for your loss. With 4 years having passed since the height of the COVID-19 pandemic, many of us have become numb to the grave uncertainty that we faced in 2020. That spring, as a novel virus took hold across our nation, hospitals overflowed with patients as hundreds and eventually thousands of Americans died each day. Frontline healthcare workers were forced to wear garbage bags as gowns, and life as we knew it had come to a total halt. Things were in absolute chaos. And in the midst of that chaos, public officials at every level of government were left to make challenging decisions in real time with constantly evolving information and extremely limited resources. Now, with the darkest days of the pandemic behind us, thanks to the Biden-Harris administration's historic work getting vaccines in arms, safely reopening schools and businesses, and jump-starting our economy, we have the opportunity to look back on those decisions and learn from them. And in doing so, we can acknowledge that in future public health crises, we would make certain decisions differently. One such case is policies that arguably required the readmission of COVID-19 patients back into nursing homes without infection prevention and control in an early effort to relieve hospital strain. In hindsight, knowing now what we do about how COVID-19 spreads, including through aerosolized droplets and by asymptomatic carriers, these policies were a misstep, and they are something we can learn from as we look to better prepare for future pandemics. However, we must be comprehensive in our examination of where things went right and where things went wrong in responding to COVID-19. And we would be doing our nation's seniors and nursing home residents a disservice by not taking a hard and honest look at the data that has emerged from that period. And this data shows us that the driving force behind the infections and fatalities that occurred in our nation's nursing homes was broader community spread, which led to dedicated staff inadvertently bringing the virus into these vulnerable settings. And as we look back on policy missteps that put our nation's seniors at risk, I would be remiss if I did not mention that the issue of community spread, the driving factor, is one that was severely exacerbated by the severe shortages of PPE and tests that our nation experienced at the hand of former President Trump and his administration's early blunders. These failures hampered our efforts to get a handle on the outbreak of COVID-19 and left states to fend for themselves when it came to obtaining critically needed supplies to protect our most vulnerable. As ranking member, I've championed objectivity and called for the Select Subcommittee to put people over politics. And in that vein, I want to make something abundantly clear. Any public official who sought to obscure transparency or mislead the American people during the COVID-19 pandemic should answer to the American public, regardless of political party. And that is why the former governor and members of his administration faced serious questions from both sides of the aisle about allegations that they misrepresented nursing home fatality data to evade public scrutiny during the closed-door transcribed interviews that led up to this hearing. It is also why I have been so forceful in my condemnation of the former president and his reckless efforts to downplay the threat of COVID-19 in the early days of the pandemic. The American people deserve honesty, transparency, and integrity from their public officials, full stop. At the same time, I continue to believe that the greatest thing we can do for the American people is contribute to forward-looking work of preventing and preparing for future pandemics. That is why today, I am leading Select Subcommittee Democrats in announcing new legislation to strengthen infection control and prevention efforts in our nation's nursing homes. The Safer Nursing Homes Act is forward-looking legislation that makes new, robust investments in the Centers for Medicare and Medicaid Services survey and certification efforts, which uncover incidents of poor or substandard care to be available for these crucial oversight activities. Our new legislation builds on the Biden-Harris administration's legacy of protecting and advancing the health of our nation's seniors. Earlier this year, the administration finalized its long-term care staffing rule, which establishes new federal standards to ensure that our parents and grandparents in nursing homes receive the highest quality care. And in 2022, President Biden and Vice President Harris took on Big Pharma and signed into law the historic Inflation Reduction Act, which capped the monthly cost of insulin at $35 for seniors a month and finally allowed Medicare to negotiate for lower prescription drug prices. One thing is certain, there is still more we can and must do to protect and advance the health of our nation's seniors. As we look to strengthen our nation's preparedness for future pandemics and public health threats, it is my hope that the Select Subcommittee can play a meaningful role in this work. And in service of every senior who we lost too soon at the hands of the pandemic, it is my hope that we can work together, every member of the Select Subcommittee, to make progress on this critically important mission so that we can save future lives. With that, I yield back.
Thank you, Dr. Ruiz. Before we proceed with witness statement, I want to announce a subpoena to the Governor of New York for documents related to Mr. Cuomo and his March 25th directive. The subpoena is vitally important as this inquiry continues, and because the current governor is improperly withholding documents from Mr. Cuomo's time that are responsive to our requests. We hope that Governor Hochul lives up to her promise of transparency and proceeds without further delay. Our witness today is Mr. Andrew Cuomo. Mr. Cuomo is governor of the state of New York from 2011 to 2021. Pursuant to the Committee on Oversight and Accountability Rule 9G, the witness will please stand and raise his right hand. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Let the record show that the witness answered in the affirmative. The Select Subcommittee certainly appreciates you for being here today, Governor Cuomo, and we look forward to your testimony. Let me remind the witness that we have read as much as we could of your written statement, and it will appear in full in the hearing record. As requested, please limit your oral statement to 6 minutes, as we agreed upon. As a reminder, please press the button on the microphone in front of you so that it is on, and the members can hear you. When you begin to speak, the light in front of you will turn green. After 5 minutes, the light will turn yellow. When the red light comes on, your 6 minutes has expired, and we would ask that you please wrap up. I now recognize Mr. Cuomo to give an opening statement.
Thank you. First, to the families of the victims here today and across the country, I am sorry for your loss, and I believe you are owed an apology because this country should have done better. There is no reason why we lost 1.2 million people, more than any country on the globe, when we have the most sophisticated medical system. This committee must deliver real answers so it never happens again, and I am here today to help in that mission. As you know, New York was hit first and worst by COVID through no fault of its own. I did daily briefings, and millions listened in because they because they needed information and guidance. And yes, I often vehemently disagreed with President Trump because from day one, he willfully deceived the American people, denying COVID's very real threat, telling us that it was like the flu, it would go away by Easter, it was a Democratic hoax, use Clorox. And his lies and denials delayed our response, let the virus spread, and this country never caught up. Trump literally said, "I take no responsibility," and he fabricated political attacks blaming Democratic governors, including saying that New York issued a health order on March 25th having COVID-positive people enter nursing homes from hospitals, which recklessly and needlessly caused thousands of deaths. And then Trump weaponized the Department of Justice, starting investigations against New York and 3 other Democratic states. Trump's shocking allegations, all false, were designed to shift blame from him to Democrats, and they did. They also created great pain, confusion, and fear for families. And this subcommittee, run by Republicans, repeats the Trump lies and deceptions, and it inherently makes 2 powerful admissions. First, their report does not deny, contrary, who said you're wrong, and who confirmed the March 25th advisory was in total compliance with federal guidelines, and that all New York's nursing home laws remained in effect, period. In addition, the report provides no evidence to support Trump's main allegation, repeated for 3 years, that New York's guidance killed thousands in nursing homes. In fact, the report finds no causality whatsoever, not one death, all hype. Why? Because it never happened. All credible studies now say that COVID came into nursing homes through community spread and infected staff, not hospital admissions or readmissions. Numbers don't lie. 35 states had a higher death rate in nursing homes than New York, including Ohio. Most Republican states actually had a higher death rate in nursing homes than New York in 2020. And that fact damns them and reveals their hypocrisy. But these are all diversions to blame New York and other states for the culpability of the federal response, which was malpractice. There was no preparation, no PPE, no testing, no masks, no science, no leadership. As one Republican governor said about Trump, the general was missing in action, leaving 50 states bidding against each other for scarce medical supplies. It was the COVID Hunger Games. The federal government was nowhere to be found. New Yorkers remember well those traumatic days when the only sound that echoed through the empty streets were the constant sirens from ambulances, when mass graves were being dug on Hart's Islands, when bodies were being stored in refrigerated trucks. Our hospital system nearly collapsed, and Trump was threatening to send federal troops to blockade New York so no one could leave. That was the federal response. And yes, New Yorkers were scared, but they were New York tough, and they showed that they responded to government leadership when they believed it was based on facts. In that moment in New York, there were no Democrats and Republicans. There were just New Yorkers helping and relying on each other. They were guided by their better angels. They followed science, took vaccines, wore masks, and acted responsibly, one for another. New Yorkers' heroic actions brought us back from the brink and saved many, many lives. When COVID started in 2020, we had the highest death rate in the country. But at the end of 2021, remarkably, New York had a lower death rate than 30 states. But even with all New Yorkers did, we lost far too many. And I'm sorry for every life lost. In closing,
What is going on with that? He sounds very strange to me too. That is not how he's supposed to sound. I don't know what the heck's going on. So, all right, let's see if we can get as close to this as we can.
And they will put this in. Sorry, all New Yorkers did had a lower death rate than 30. But at the end of 2021, remarkably, New York had a lower death rate than 30 states. But even with all New Yorkers did, we lost far too many.
I don't. What the heck is going on here?
Had a lower death rate than 30. But at the end of 2021, remarkably, New York had a lower death rate than 30 states. But I sound strange. We lost far too many.
We both sound very high pitched and like a little faster. Hold on, I'm trying to lower my phone volume too. So, what the heck? Yeah, you do sound. I do sound weird. It's my internet. Ah, the internet. Let me see which one I'm on. I need to figure out. So here's the situation with the 5G. I have the 5G cord, the cable going all the way up to like right where the internet box is, but I don't know how to get through some of the studs in the wall to get there. It's like right there. I'm like in the 99-yard line. This is still. Oh my God. Hold on. How do I fix this? Let me. Let me see if... Did we do it? Did I manage to... I think I did it, right?
And I'm sorry for every life lost. In closing, I know this is a political year, and I have testified before many, many congressional committees. But this issue really matters. There will be another pandemic, and they will pull out your report for guidance. I hope it has real answers. God forbid 1.2 million people died in vain. Thank you.
Thank you. I now recognize myself for as much time as I may consume for questions, with equal time being afforded to the ranking member of the committee. The question is asked, did the federal government require that the state of New York mandate that its nursing homes admit or readmit residents? The answer is no. Did the federal government mandate that your state issue a directive that prohibited a nursing home from testing an admitted or readmitted resident for COVID-19? The answer is no. In fact, I don't believe I'm aware of any other state besides yours that expressly prohibited a nursing home from testing returning or newly admitted residents. Only in New York. The other states that have been alleged, issued similar orders, none were in place as long as New York.
First course. And I surmise, because it doesn't take a doctor to realize that it was a dangerous, misguided plan. Nevertheless, Governor, you've maintained and testified to us since the pandemic that your directive was based on and consistent with CMS and CDC guidelines. You're a lawyer, so you know the difference between permissive versus prescriptive language, I assume. And the word shall and must, are they permissive or prescriptive? Governor, are the words shall and must permissive or prescriptive?
It depends on the context.
Okay. Well, those words are right in the directive. This was not advisory or guidance. CDC guidance. Did you ever speak with anyone at CMS or CDC about the directive beforehand?
You'd have to ask the Department of Health had those conversations.
So what you're saying is, we interviewed said they consulted with them to ensure the applicable science was being followed. Former White House coronavirus coordinator, Dr. Deborah Birx, she was in charge of all federal guidance in 2020. She testified that your order absolutely violated CMS guidance. Is it your position that Dr. Birx lied?
My position is you deceived Dr. Birx. You suggested to Dr. Birx that we did not have transmission-based precautions in place, and that was not true. As you know, the Attorney General conducted this investigation. This is not new news. These charges were made 4 years ago. You then had 3 Department of Justice investigations that 25th advisory did not require admission of COVID-19 patients into nursing homes, but rather said the admission could not be denied solely. Merriam-Webster says that means only on the basis. Some commentators, and these were Republican commentators she was referring to, suggested Department of Health March 25th guidance was a directive that nursing homes accept COVID-19 patients even if they could not care for them. Such an interpretation would violate statutes and regulations that place obligations on nursing homes to care for residents. The March 25th guidance was consistent with the CMS guidance. The March 25th guidance was consistent with the CMS guidance. If nursing homes have the ability to adhere to infection prevention and control recommendations, it was also consistent with CDC published transmission-based precautions. That's the Attorney General's position and opinion, and that's the law of the state of New York. And when you spoke to Dr. Birx, you posed the question suggesting we did not have infection protections in place, and that was not true.
Mr. Cuomo, you're a lawyer, so you know the difference.
In a context, I will interpret it for you, as the Attorney
word
General
shall-
did here.
Thank
As
you.
the Attorney General did here.
Yeah, are the words shall and must permissive or prescriptive?
Depends on the context. In this context, the nursing home, all the laws of the state of New York remained in effect. As a matter of fact, the law of the state of New York says they can only accept people who they can care for. The law of the state of New York says they have to do a full diagnosis before a person comes in. If they have a communicable disease, they have to have a written letter saying the person is not infectious, place. So every law in the state of New York governing nursing homes was in effect, sir.
Well, Governor, there might be a lot of lawyers who disagree with you. Using the
Attorney
word,
General
using the,
governs.
excuse me, using the word shall and must. These words are right here in the directive. This was not advisory or guidance. It wasn't. You have also claimed that the directive followed CMS and CDC guidance. Did you ever speak with anyone at CMS or CDC about the directive beforehand?
The Attorney General said it follows CMS guidance and is consistent with CMS guidance. When you talk about attorneys, yes, I'm an attorney. Yes, I'm the former Attorney General of New York. But the law is interpreted by the current Attorney General. That is how she interpreted the law. That is the law that was in place. That was the law that was in place during the pandemic. She has sued nursing homes for misconduct during the pandemic based on that law.
Thank you, Governor. My question was, did you ever speak with anyone, you, Governor Cuomo, did you ever speak with anyone at CMS or CDC about the directive beforehand? You, Governor Cuomo.
You asked that question, and I answered the question, and I said no.
Did you or not?
I said no. I answered the question.
Okay, thank
no.
you. Not even after, correct?
I said yes, and they never called me after. You would think if they had a problem with the directive, they would have called. If it was
You
so
di-
outrageous, as
You didn't even
suggest,
call
they would have
to, you
called.
didn't even call to ensure that you were, what you were declaring was accurate. Yes or no?
I don't know if the Department of Health,
Did you,
which issued
Governor Cuomo, right now I'm talking to you, Governor
Yes.
Cuomo,
The-
did you even attempt to ensure that what you were declaring was accurate? I'm asking you.
Yes, I
I don't want to
understand.
hear about anyone else.
Okay. Department of Health issued 400 advisories, several per day. I did not speak
Thank
to
you.
CMS about 400 advisories.
Thank you. In fact, no one we interviewed said they consulted with them to ensure the applicable science was being followed. Former White House coronavirus coordinator, Dr. Deborah Birx, she was in charge of all federal guidance in 2020. She testified that your order absolutely violated CMS guidance. Is it your position that Dr. Birx lied?
You misrepresented the
I'm
facts
asking a
to
question.
Dr.
I'm
Birx.
stating what she said. I'm not misrepresenting anything.
Well, what,
Because this is what she said, and I just want you, I'm asking you if Dr. Birx lied. That's my question.
Dr. Birx said that the March 25th advisory, which you read to her in your words, didn't have appropriate infection control procedures. That was by your representation. The Attorney General's representation is the law of the state of New York was in effect, which has an infection control plan, mandates they only accept people who they can handle, mandates that if the person is a communicable disease, that it's treated before they accept the person or they don't. So the infection-based control precautions were in place. The question to Dr. Birx was, would you allow admission if there were no transmission-based precautions? And she said no. And I would agree, but they were in place.
So many states reverse course. And I surmise because it doesn't take a doctor to realize this is a dangerous, misguided plan taking place in New York. Nevertheless, Governor, you maintained, testified to us since the pandemic that your directive was based on and consistent with CMS and CDC guidelines. and you're a lawyer, so you know the difference between permissive versus prescriptive language, I assume. Are the words shall and must permissive or prescriptive?
It's not my lawyer, it's the Attorney General of the state of New York who interprets the law. That's how the law works, sir.
I now recognize the ranking member, Dr. Reeves from California, for 5 minutes of questions.
Thank you, Mr. Chairman. Something I believe every member of the Select Subcommittee would agree on is the obligation that every public official has to be transparent with the American people, especially during a public health crisis. Transparency, including with public health data, is necessary for public trust, and it's expected of those who hold elected office. What's more accurate and comprehensive data is critical to develop forward-looking policies to prevent and prepare for future pandemics. As an emergency physician, I know firsthand that when dealing with a new and evolving public health crisis, every piece of data can help build a better picture of what we are facing and inform better decisions. Governor Cuomo, I appreciate your voluntary participation in today's hearing, as well as your cooperation with the Select Subcommittee in recent months. After reviewing nearly 200,000 pages of documents and conducting 10 closed-door interviews, questions still remain regarding the extent of which your administration was transparent in reporting nursing home fatality data, both with respect to the daily numbers and the numbers included in the July 6, 2020 New York State Department of Health report. As an initial matter, let's talk generally about your administration's public reporting of COVID-19 related deaths. So, Governor Cuomo, your administration publicly reported COVID-19 related deaths with a fatality tracker available on a public website, correct?
Yes, sir.
Okay. The New York State Department of Health also posted a daily report specific to nursing home deaths on a publicly available webpage, right?
I don't know specifically what the Department of Health had separately.
Okay. Initially, the nursing home fatality data included deaths both in facility and out of facility, meaning in the nursing homes or nursing home patients who were moved out of the facility to a hospital, for instance. However, in early May 2020, this reporting changed to only in-facility deaths. Was this change your decision?
No, sir.
Whose decision was it?
I don't know.
This change obviously made the reported number of nursing home-related deaths lower. Do you know if that was the reason for changing the reporting?
No, if I may, Doctor. Every day, I personally did a daily briefing and reported the number of deaths. The surest place with the most certainty was this is the place where they died. Every night we got a census from the hospitals. Every night we got a census from the nursing homes. Total nursing home deaths, total hospital deaths. I had confidence of a pandemic. Please track this patient. They went from the nursing home to home, and what happened? They went from the nursing home to the hospital. Can you find out what happened? The confidence level in the out-of-facility deaths or presumed deaths was very weak and very low. It was very important to me that whatever I said, I knew was accurate. They asked for out-of-facility deaths. They asked for presumed deaths. I said, when we have accurate numbers, I will release them. But I'm not going to release numbers that I don't believe and we have reason to believe were false. And there was a lot of double counting and a lot of mistakes in those numbers. And Doctor, my briefings attracted people because they got the truth. And whereas President Trump would say a different thing every day, I only said what I knew to be a fact. And I was not going to put out a number unless I knew it was true. I said I was not putting out the out-of-facility deaths until I knew they were true, but the total number was unchanged. In other words, the out-of-facility deaths would have just reallocated deaths from hospitals to nursing homes. and reduce the hospital number. But the total death number was exactly the same.
So the daily reporting was not the only way the New York State Department of Health shared nursing home fatality death with its public. There was a report released on July 6, 2020 that purported to be an in-depth analysis of nursing home data. During the past several months of transcribed interviews, Select Subcommittee staff heard from multiple witnesses that this report started off as a data-driven scholarly article with work from several Department of Health employees. But prior to its release, decisions were made by members of your executive chamber who were not public health experts to change the numbers in this report. Again, the changes made lowered the number of nursing home-related fatalities included in the report. So were you aware of the fact that there were seemingly two versions of what was released as the July 6, 2020 New York State Department?
Was not to do a scholarly article for a medical journal. We were in the middle of a pandemic. And there may have been people who wanted to do a scholarly article for a medical journal, but this had a much more practical purpose. We're in the middle of a pandemic. How was COVID getting into the nursing homes? That was the question. How was COVID getting into the nursing homes? And that was the purpose of the report. There were multiple sets of numbers because the numbers kept changing because the nursing homes were under tremendous pressure, and this was a tremendous accounting task that we were asking them to do. The report used the verified numbers, and I said, because this was a question every day, doctor, this was not like surreptitious. I said, when we have the out-of-facility numbers that we believe are accurate, we will release them. They were not in the July 6th report. The health commissioner said he had the verified numbers, there were unverified numbers. They both backed the same conclusion in the report, so he decided to use the verified numbers, and we said when we audit the unverified numbers, we will release them. So it was everyone was always clear. Here's the total death. Here are the subcategories that we feel confident about. Here's what we don't feel confident about. Also, this was very political at the time. President Trump was accusing me of overcounting the number. He said I was inflating the number to make him look bad, that there were actually fewer deaths, and I was inflating the number. So it's ironic that now the accusation is, oh no, you were undercounting the number, right? But you have to pick it at one point.
So let me just ask you directly, and let me remind you that you are under oath, Governor. Did you direct your staff to make the number of nursing home-related fatalities lower than they actually were?
No, we said numbers without the out-of-facility death numbers, which we will add when they're accurate, which will reduce the hospital count number, but the total death number stays exactly the same. It was an allocation question. Do you allocate the death to the nursing home, or do you allocate it to the hospital? But the total death number was the same. And the only reason the Republicans were asking these questions about nursing home deaths was to further their conspiracy theory that there were massive deaths in nursing homes, which in my opinion was a pure diversion from the federal malpractice that was going on, because everybody knows that COVID did not get into nursing homes from admissions or readmissions. It came in from community spread. And the reason why you had so many infected staff workers going to work was because the federal government had no PPE, no masks, no equipment, no warning, no preparation. We had a president who lied to us from day one.
As ranking member of the Select Subcommittee, I'm committed to following the facts for an objective analysis of how COVID-19 impacted our communities across the country, all with the goal of putting us on stronger footing to prevent and prepare for future pandemics. As I said, accurate and complete data is vital to ensuring that we as a country are as prepared as possible to handle the next pandemic better than the last. And with that, I yield back.
And I recognize the chairman of the full committee, Mr. Comer from Kentucky, for 5 minutes of questions.
Thank you. Governor Cuomo, do you stand by the March 25th, 2020 directive?
The March 25th directive was based on the CDC CMS guidance.
So you stand by it?
They both do the same thing. Both
You have
CMS,
said that,
CDC, and DOH.
excuse me, you
defend
have
it.
said that the directive followed CDC and CMS guidance. Are you aware of anyone in your office that asked CDC or CMS about the policies in the directive?
The Attorney General opined legally they were the same and said the March 25th order was consistent with the federal guidance.
Okay,
and
so
that's
you
how it
stand
was
by it,
enforced.
and you say it followed federal guidance. Then why did it need to be superseded by executive order? Was this because
It was
you were getting
superseded
bad
later
press?
on. I'm sorry, I didn't mean to interrupt you.
Oh, go ahead.
It was superseded later on because we then got to a position in May, I believe, where we had enough testing capacity and we mandated testing
so-
for nursing home staff.
So it had nothing to do with public relations or bad
And it
pressure?
also, this was all politics all the time.
Okay.
And it bothered and scared people because they didn't know who to believe.
Okay. So on June 7th, 2020, your executive assistant sent this email writing, and I quote, "This is going to be the great debacle in the history books. The longer it lasts, the harder to correct. We have a better argument than we made. Get a report on the facts because this legacy will overwhelm any positive accomplishment. Also, how many COVID people will return to the nursing homes in that period? How many nursing homes? Don't you see how bad this is? Or you admit error and give up." She wrote this email on your behalf.
Yes.
Governor, did you have an email account while you were governor?
No. Well, I may have had one, but I didn't use it.
Okay. Was there a reason?
I haven't used it in years.
Did you communicate in other ways with your staff? Text messages or BlackBerry
Yes.
send messages? You did. You just said that you stood by the directive, but this email asked if it was time to admit error and give up. Was the March 25th directive an error?
No, this was the last line, sir, was tongue-in-cheek.
Okay.
This was an ongoing, raging political debate where the Republicans were saying March 25th caused deaths.
So
I said, answer it fully.
I understand, Governor. You testified that you were not aware of the directive until April 20th, 2020, almost a month after it had been issued. When you were asked about it at a press conference after you learned of the order, did you have any concerns about the directive?
When I was asked about it at the press conference, I was not aware of it. If I had been aware of it, my answer would have been very simple. I would have said, ask Donald Trump.
Did you ask
CMS,
questions after you learned about the directive?
After I learned about it,
What
yes, I asked questions.
Give me some examples.
I was debriefed by the Commissioner of Health, who said, this is the theory of CMS and CDC and DOH, that these people are no longer infectious.
Did you ever discuss terminating or amending the directive after you learned of it?
When it was described to me that CDC, CMS, and DOH all thought this was a good idea, and they had a medical theory behind it, that these were non-infectious people, et cetera.
For time's sake, Governor, to return to the email, why did you direct your staff to get a report on the facts?
Well, just to counter the newspaper story.
So on July 6, 2020, the Department of Health issued the report you requested. Was this report peer-reviewed?
I don't know.
It was not. Was this report in a medical journal?
It was not. It was a
It was
government
not.
report. It was not
the-
for a medical journal.
Was the executive chamber involved in the drafting and editing of the report?
I'm sure the executive chamber was.
It was. So you requested a report on the facts, and you got a report that was not peer-reviewed, not in a medical journal, and drafted and edited by the very body accused of wrongdoing. So, Governor, do you stand by the July 6th report?
So this is in real time. We're acting. An agency is taking an action. You ask the agency for a report on the
And
action.
Governor, my time has expired. Mr. Chairman, what's clear is the governor was desperate to change the narrative, to dispel of the notion that his administration failed nursing home residents, that he failed to ask any questions. And Governor, I believe you failed to follow the facts, and it's now clear that you should have done what your assistant suggested in the email, and that was admitted error and given up.
If you believe the CMS and CDC were wrong, then that would be your position.
I now recognize the ranking member of the full committee, Mr. Raskin from Maryland, for 5
Mr.
minutes.
Chairman, thank you very much, and Dr. Ruiz, thank you. Thank you for your testimony. Governor Cuomo brought against you today are obviously serious, and because we on the Oversight Committee believe in accountability for all public officials and to answer every question coming at you and to address what the majority is saying. But I confess, Mr. Chairman, that I'm appalled by the majority's decision to evade and bypass the central events of the epidemic for totally political reasons. The broader and authentic context for this hearing is, of course, the spectacular failure of Donald Trump's reckless and incompetent pandemic response, a failure which led to the unnecessary deaths of tens or hundreds of thousands of American citizens, according to Trump's own officials. In fact, Donald Trump's knowing and willful lies cost America at least tens of thousands of deaths, according to his own White House coronavirus response coordinator, Dr. Deborah Birx, who the chairman just cited as a decisive professional and medical authority. And she told the select subcommittee that more than 130,000 lives would have been saved during the Trump administration if basic and proven public health measures had been implemented instead of disregarded. On January 22nd, 2020, when America identified its first case of COVID-19, Trump stated, quote, "We have it totally under control." He goes on to say, "One day it's like a miracle. It will disappear. It is going away." He then proceeded to abdicate any responsibility for our pandemic response and said, quote, "I don't take any responsibility at all." When he systematically failed to supply the states with critical medical equipment and PPE, he set off an interstate death match for medical supplies, telling governors simply to, quote, "Try getting it yourselves." Donald Trump said about the virus, "I always wanted to play it down." Despite privately acknowledging that COVID-19 was deadly stuff, he deceived America, assuring everyone the virus was, quote, "just a little like the regular flu." And he embraced the herd immunity theory that some of his advisors were promoting, which was, again, a dangerous and destructive thing to do. After watching the bodies pile up outside hospitals and morgues, Trump then announced he had magical cures. He gave quack advice that hydroxychloroquine or disinfectant might be effective treatments for COVID, and he predicted the virus would, quote, "like a miracle, disappear by Easter." Despite advice, Trump touted hydroxychloroquine and azithromycin as, quote, game-changing, controverted. And I appreciate the fact that Governor Cuomo has appeared voluntarily to answer the questions. Where is Donald Trump to answer the questions about his horrific negligence as identified by his own COVID-19 advisor? Governor Cuomo, New York was one of the states hit first and hit hardest by the pandemic. And I'm sure you have some regrets about the decisions that were made in the federal government, at the state level, including in New York at the local level. But do you have any doubt that Donald Trump's lies about the virus and his deliberate failure to develop a national policy to help the states made it more difficult for New York and other states to manage their pandemic response?
Congressman, I lived this like few others. I have little doubt that the problem here was what happened with the federal government. They want to blame the states. They want to focus on New York. I understand why. It's a blue state, et cetera. New York was the 29th lowest in nursing home deaths. Most Republican states had many more deaths.
Is that per capita or hard numbers you're talking about?
That is pro rata, so per 1,000 nursing home deaths. So state of New York, for example, had 70 deaths per 1,000 in nursing homes in 2020. Ohio, for example, had 97 deaths. You don't see Ohio here today, or any of the other Republican states. It's just a diversion. What happened here, and the number that matters is 1.2 million died, more than any country on the globe. How do you explain that the United States lost more people than China, that has 4 times the population? And we know why we lost, why this happened, because the president denied it for months. The CDC had no tests. There was no PPE. And we lost 3 months before the president woke up and realized that there was a virus, and it was too late because the infection had spread, and you're not going to catch up.
But did you have a problem with then President Trump repeatedly praising President Xi for the pandemic response in China and saying that he was doing a marvelous job?
The president's response was horrific, and the major cause why the virus spread and why it became out of control.
The gentleman's time had
That's why-
expired, so I now recognize Ms. Stefanik from New York for 5 minutes of questions.
Thank you, Chairman Wenstrup. Today is long overdue. And just as a reminder for the public tuning in, we are here today on behalf of the over 15,000 vulnerable seniors in nursing homes who died because of Governor Cuomo's fatal executive order on March 25th, damning them to this horrible fate, including constituents in my district and every congressional district in New York State. I also want to recognize the families and advocates who have been working tirelessly with senior aides. Let me begin first. After months of inquiry and investigation, we now know irrefutably what New Yorkers have known for years, that Governor Cuomo himself and his most senior aides ordered, directed, and executed this deadly executive order counter to CMS and CDC guidance. Our investigation also reveals, a bipartisan investigation, that the disgraced former governor and his top aides were caught covering up their cult to selfishly save their shredded reputations. I want to start with the March 25th directive. Isn't it correct, former governor, that Dr. Zucker served as your commissioner of health during the COVID crisis?
Yes.
And you have stated and shared that you have great respect for Dr. Zucker and his professionalism? Yes. Are you aware that Dr. Zucker testified that the March directive was prompted by a direct request to you, former Governor Cuomo, from the Greater New York Hospital Association? Are you aware of that fact?
I'm not aware of his testimony, no.
Well, that was what he testified to this committee. Dr. Zucker also went on to say, quote, Greater New York Hospital Association called the governor and the team. We were all there in a conversation, end quote. I also want to add, are you aware that another staffer at the Department of Health testified that the March 25th order received sign-off from the executive chamber? Are you aware of that fact?
No, I'm aware of the testimony to the exact opposite that you received.
That is incorrect. He said, yes,
That's not the testimony that I have before me.
The testimony I
Mr.
have before
Hutton.
me, when he was asked whether the March 25th order was signed off by the executive chamber, the answer was yes, absolutely. And on top of that, Dr. Zucker testified that, quote, everything goes through the governor's office. And by the way, Governor, you and I both know that under your terrible leadership in New York, everything does go through the...
There's a fact in what you said.
No, I'm asking you a
was there by
question.
mistake.
I'm asking you a question. What dates did you negotiate for your book deal? That is the question before you today.
Answering a question that
No, no,
you
no.
asked.
The question that I
My
asked.
testimony says, during
No.
that time, did you have any discussions with the executive chamber regarding the need for guidance?
That's not the testimony